I'd like now to introduce my beloved friend Carmen Comsti. Carmen is the principal writer for the National Nurses United, which is the national CNA here in California. She was a member of Newsom's commission and submitted the unique opposition position from the final report of that presentation. She was graduate from University of Berkeley with a JD, so she's no piker. I mean, she's really a serious intellect and legal mind. And I asked her to come because I needed there to be a heartful bond between us and the CNA, who we adore and support. We don't know yet what's going to happen, but she'll let us know, and we hope that this will be an ongoing dialogue and conversation.
I want to thank you all. It's really important with me representing the California Nurses Association, all the nurses that I represent day to day, pushing for the guarantee for healthcare for all, that we talk to you all as doctors, as retired doctors, as current practicing medical professionals, that we come together and find our voice to advocate for patients. I think this is really at the heart of what I want to talk about tonight. What do we need to change in terms of our culture, on how we view medicine, how we view health, and I really want to, I think the struggle that we have as single-payer advocates, as healthcare professionals, as folks who represent healthcare professionals, what is the underlying issue? And it is an ethical issue of how we view healthcare in the United States. Guaranteed healthcare for all is something that is possible. We know that it can happen. We know that single-payer healthcare, that CALCARE, that Medicare for all is the only system that will cover everyone, cost less, but provide more benefits. Everybody in, nobody out. That's why it's the same. We know that it's the only way that we can truly fix the system. The issue of single-payer as a means of dismantling this fundamental obsession over profit-driven healthcare, over market economics. We are at a battle with the heart and soul of how our society works and how we view each other. And healthcare in the health policy world, we know this has been conceived of largely as a market, largely as a business. And we've heard ad nauseum from political pundits that doctors are greedy, that you all are out to make money. And this is why it's important that you all, as physicians, as medical professionals, engage to say that, no, you entered this profession to care for people. And we hear politicos parrot industry talking points that we must control utilization. We must control use of our healthcare system because we have to control spending. And ultimately, why? They want to make more money for themselves. When we have healthcare professionals actually making the decisions on care, then utilization will be taken care of. If we care for people up front, then that will help them get the care that they need so that we're not ultimately pushing people to higher costs without recognizing that cost containment, if you leave it up to the corporations, will just cut care. They will cut care. They will cut the reimbursement rates for providers. We need to protect the true cost, which is making sure that each of you as physicians have the staff and the tools that you need to care for your patients. This is why when we talk about CalCare, when we talk about Medicare for all, we talk about changing the reimbursement structure so that we're paying for the care that's needed rather than going to the pocketbooks of administrators, going to unnecessary prior authorizations. I think that's really fundamentally what we're saying, even though it's a very highly technical concept of like how do we redo reimbursement structures. At its core is that we are paying for the care that we need. Ultimately, we ended up with the Affordable Care Act, which is more competition for competition's sake among health insurers, rather than getting rid of the insurers altogether. Because a conceit here, and it's a neoliberal conceit, is that if we have more competition, then it will resolve all the issues because the market will fix itself. And we know that this is a bill of goods. We know that if you keep insurers, even if there are multiple insurers who are competing against each other, this means that they are trying to reduce their costs so they can make profit for themselves. And we've seen this emerge even more in our Medicare and Medicaid systems, where we see more accountable care models, where private health plans or financially interested intermediaries use public programs to allegedly manage care. And I think this is what, in the next couple of years, as single-payer advocates, we really have to watch out for, is this idea that we can have a public program with private health plans in it. We've seen how Medicare Advantage can cause denials of care. It ends up leaching off of the public system by, we have health plans increasing reimbursement rates, gaming the system, and then denying care. Privatization reforms have been sometimes packaged in the past couple of years, as positive, as necessary steps and necessary compromises before we can get guaranteed health care for all. And we have to watch out for that, because more insurance is not going to help. More intermediaries who are not healthcare professionals are not going to get us to guaranteed health care for all. Some statistics, because we want to know that our analysis is correct. The Office of Inspector General from the federal HHS, they came out earlier this month with an analysis of Medicaid's managed care plans on prior authorization, and request rates for prior authorization in California for Medicaid managed care plans were as high as 29%. And then in other states, as high as 41% for Medicare managed care plans. And this was just a recent study by the Office of Inspector General. And I think a lot of this kind of analysis on the federal level of the insidious nature of these privatization schemes of our public systems has been coming to a fore. There's more analysis of the fraud and the money grabbing that's happening in our public systems. And I think a lot due to the work that PNHP has been able to do on the national scale on pushing back against direct contracting for Medicare, against this idea that health plans and intermediaries can quote unquote fix the public programs. The U.S. Department of Justice sued Kaiser Permanente for its Medicare Advantage plan. And it alleged that Kaiser systematically engaged in upcoding. The DOJ asserted that Kaiser went so far as requiring doctors to go to coding parties, and that Kaiser would reward the individual doctors that, quote unquote, refreshed their patients to a higher reimbursement code at a higher rate. So, you have Kaiser Permanente Medical Group doctors who, if they want to keep their job, they have to go and upcode, and then if they do a good job at it, they're rewarded financially. Another analysis, this time by the New York Times last year, it reported that the average overbilling by Medicare Advantage plans from upcoding in 2020 was somewhere between $12 billion and $25 billion, with a B, for 1 year. Medicare Advantage plans. And this is the New York Times, so, they're, they do have corporate donors, and they are telling the story of the insidious nature of privatization within our public systems, and we have to be vigilant against these moves. Doctors and nurses should question this premise of market economics and market competition in our healthcare system. I think each of us, for each doctor, for all of our nurses, should question this idea that you all should be motivated by economics, motivated by financial gain. And these privatization models, they assume that you all are out there for money. So what is happening is that they incentivize doctors to act on their pocketbooks. This is why we see these payment incentive schemes. They ask doctors to have, quote unquote, insurance risk. They ask doctors to have skin in the game. This is exactly what we want to avoid. We don't want to make you all business people. I'm sure none of you went into the medical profession to run a business, but that is what the young students who are in medical school are being asked to do today. And I think this is why it's important to really question the motivations that we're placing in our healthcare system. We're being driven by the market, by economics. We are telling our doctors to think about money when they're caring for their patients. And for those of you who might not want to do that, you may not be able to practice because you have Kaiser pushing you to do upcoding parties. So it's fundamentally, there is something that is festering in our healthcare system where you as doctors cannot practice without interference from the profit-driven motives of corporations and insurance companies, where you're out there trying to compete against each other for reimbursement dollars. And I know it's difficult when you're treating a patient and they tell them, I have a deductible, like I can't see you again. Like you're literally being put up in competition with your fellow medical professionals. It's important for us to remember that you all, as physicians, as medical professionals, are in the unique position of being able to tell these stories about your patients not being able to get the care that they need. It's one thing to say that there are insurance barriers to care, that there are prior authorizations, that there's step therapy, that there are narrow networks. But when you can see that your patients aren't getting the care that they need because of the arm of a profit-driven system by a profit-driven insurer, it makes a difference to these politicians. Really, what you all as physicians can bring to the table are these stories of your patients and how they have been suffering because of the system, how you, in your professional judgment, has been impacted by the insurance system. And it's important that these stories get out because, as healthcare providers, your reputation is being smeared by these political pundits that say that you're being motivated by greed. And so they're trying to reduce your ability to practice medicine. They don't trust you. The politicians believe that doctors aren't out there for their patients, but we need to change that narrative to say that the best thing for our health in this country, in California, is to ensure that healthcare professionals can do their jobs. It's a simple kind of plea to say that when we're asking for single-payer healthcare, we are asking that doctors and nurses and all other healthcare professionals can simply do their jobs And when you all can do that, we will save money, provide care to everyone, and provide more. We can provide more care to everybody. And it will ultimately save money for the system. And so we can put that money back towards care. And I think, we can put that money towards actual healthcare planning so that rural systems can get the funds that they need to attract new doctors to work in those fields. So we can target health inequities that need more support to ensure that people have the care that they need before we have folks with higher disease burden coming into their PCPs or the hospitals. With a single payer system, it's important to know that we can do the things that Dr. Bronson was saying, that we can do the things that you all have been asking for, which is that we can actually plan in a democratic fashion and have an accountable government rather than a corporate boardroom, looking at where health inequity happens and planning on how to fix it so that we can have programs that support programs to fix the healthcare inequities that we've seen for decades. We have to think bigger and bolder and ensure that we have a united front with all of us in one system so that we can plan and help each other. That is how we end the structural health inequities that we've seen. This is how we end the structural racism of our system of healthcare, is that we are all in it together, the doctors, the nurses, the patients, the other healthcare professionals, to say that we can see inequity happening and we're going to find a plan to do it. It is ultimately a redistributive model of healthcare where we know that we don't want the high concentration of providers and facilities in the areas where insurers can get the most money. We hear it all the time, everybody in. But this is what we're saying. We are one community, and we will work together to ensure that everybody has the health care that they need. And it's important that you all as doctors challenge the backwards ideas of our market competition-driven healthcare system. And with that, I know we're in this fight together, and I will see you as our CalCare bill is reintroduced next year.
Thank you so much, all of you. Carmen, I can't thank you enough. I mean, the sweetness of the exchange is really moving. I mean, it's really moving to me. And I'm very grateful for all of you being here and making this thing happen. Thank you very, very much. I mean, I'm just profoundly grateful. And we got to get back to work, because this is the most important thing that's going to happen in our lifetime. No question.